country are very anxious. I've been getting calls into all day today from nurses that are saying possibly be carrying the virus and transmitting to other patients or certainly to work. I'm very nervous about that.
The Ontario Nurses Association calling on the province today to strengthen guidelines that leave the door open for hospitals to circumvent self-isolation protocols for staff who have recently traveled. City News obtained this email sent to staff at St. Mike's, St. Joseph's and Providence Hospital. It says if your job is critical to providing patient care and you cannot work from home, you should return to work while using personal protective equipment, actively self-monitoring for symptoms and undergoing regular screening during the 14 days, including taking your temperature twice daily.
We find that very, very problematic in that, A, people can be carriers and transmit without symptoms. That's a problem.
Our newsroom received numerous calls from healthcare staff concerned about their hospital's procedures, including a nurse from Sick Kids. This afternoon, Sick Kids did confirm to us that they are allowing staff to skip the self-isolation period after travel if they're deemed critical to the hospital's operations.
What we understand, and what I've seen in some memos, is employers saying, we're just going to deem everybody critical and essential, and we're not going to have those discussions. We want everybody back in the workplace.
The president of ONA says not all hospitals have implemented this protocol and suggests the move should only be considered if there is a shortage. The province has already made a call out for retired nurses to return to the workforce. Meanwhile, some who aren't dealing directly with COVID-19 patients say there aren't enough precautions in place to protect against unintentional spread of the virus.
We as healthcare professionals saying that we need to treat every individual who comes in as a risk factor for COVID-19.
One ER nurse who spoke on condition of anonymity says she and her colleagues aren't allowed to wear masks or protective gear when dealing with patients for concerns unrelated to COVID-19. But even without symptoms, there's no guarantee they don't have the virus.
If I'm going to serve asymptomatic patients, I want to gear up so that I'm protecting myself and I'm not spreading it to the next patient that I meet.
Public Health confirmed this week there has been community spread in the province. A 51-year-old man who died Thursday had no history of travel and no known contact with a COVID-19 patient.
I'm scared. I don't even want to go back to work. I have young kids as well. I have my family. We feel as nurses we're dispensable.
The Ontario Nurses Association has stopped short of calling for all healthcare workers to wear protective gear in hospitals, though they are concerned about the types of masks that are being worn by those dealing with COVID-19 patients. They'd rather see them using more fitted N95 masks. Now, back in 2003, nearly half of Ontario's SARS patients were healthcare workers, and 2 nurses from the GTA died. Ginella Massa, City News.